This blood pressure medication lasts longer than any other ARB. But that also means its side effects can surprise you. Today we reveal 1. Telmisartan's most unexpected side effect, not dizziness. 2. Why some patients feel worse in the first 2 weeks. 3. The one simple trick to avoid blood pressure crashes. If you take this ARB, you need this info. What is Telmisartan? Telmisartan is a prescription medication, often sold under the brand name Icardis, and it's also available in a generic form, which typically costs less than the brand name version. However, the generic may not come in all the same strengths or forms as the brand name drug. Why it's used. Telmisartan is primarily used to lower high blood pressure. Keeping blood pressure in check is crucial because high blood pressure can lead to serious health problems like heart disease and stroke. Additionally, Telmisartan can be used to reduce the risk of heart attack, stroke, or death from heart disease in adults aged 55 or older who are at high risk of heart problems and cannot take another type of medication called angiotensin-converting enzyme (ACE) inhibitors. To help control high blood pressure, Telmisartan is often used alongside other blood pressure-lowering medications. How it works. Telmisartan belongs to a group of medications called angiotensin receptor blockers, ARBs. These are drugs that work in a similar way to help treat similar health issues like high blood pressure and heart problems. Telmisartan works by blocking the action of angiotensin, a substance in your body that normally causes your blood vessels to tighten. By blocking this effect, Telmisartan helps relax your blood vessels, making it easier for blood to flow. It also helps your kidneys remove excess salt and water from your body, which contributes to lower blood pressure. In short, Telmisartan helps to relax your blood vessels and reduce fluid retention, making it easier for your heart to pump blood and reducing the strain on your cardiovascular system. Telmisartan side effects explained. Let's take a closer look at 8 possible side effects of Telmisartan and what you can do about them. 1. Dizziness. Feeling dizzy is a common side effect when starting Telmisartan or after increasing your dose. This happens because the medication works to lower your blood pressure, which can cause lightheadedness, especially when standing up quickly. Tip: to prevent falls, sit or lie down until the dizziness passes. Be cautious when standing up, especially after lying or sitting down. Avoid activities like driving until you know how Telmisartan affects you. If dizziness doesn't improve, it might be a sign that your blood pressure is too low. This is more likely if you're also taking a diuretic or another blood pressure medication. If it's severe, talk to your doctor. 2. Headache. Headaches are another side effect, though they are usually temporary and go away as your body adjusts to the medication. You can manage headaches by staying hydrated and applying a cool compress to your head. Tip: you can use over-the-counter OTC pain relievers like acetaminophen, Tylenol for relief, but avoid NSAIDs like ibuprofen, Advil, as they can interact with Telmisartan. Always check with your healthcare provider first. 3. Diarrhea. While rare, diarrhea can occur in some people taking Telmisartan. If it happens, try to stay hydrated and stick to bland, easy-to-digest foods. Tip: if diarrhea persists or becomes severe, let your healthcare provider know. In some cases, it could indicate a more serious condition, so don't hesitate to reach out for advice. 4. Back or muscle pain. Some people experience back or muscle pain while taking Telmisartan, although it's unclear if the medication is directly responsible. Tip: gentle stretching, regular exercise, and using a heating pad or ice can help alleviate muscle pain. If the pain doesn't go away or worsens, consult your healthcare provider for guidance. 5. Upper respiratory infections. Taking Telmisartan can slightly increase your risk of upper respiratory infections, URIs, like the common cold. Symptoms may include a sore throat, stuffy nose, and cough. Tip: rest, stay hydrated, and use OTC medications to relieve symptoms. Just be sure to avoid any medications that could raise your blood pressure. Ask your pharmacist for guidance if needed. 6. Heartburn and nausea. Some people may experience heartburn or nausea while taking Telmisartan. Tip: if this happens, you can take Telmisartan with food to help reduce stomach upset. Over-the-counter heartburn medications might also help, but if symptoms persist or are severe, contact your healthcare provider. 7. High potassium levels. Telmisartan can increase your potassium levels, which may become too high in some cases, a condition called hyperkalemia. This is more likely if you're also taking other medications that raise potassium levels or if you have kidney problems. Tip: your healthcare provider will likely monitor your potassium levels regularly. If you experience symptoms like chest pain, weakness, or an irregular heartbeat, seek medical help immediately. Kidney problems. Telmisartan can benefit kidney function, especially in people with chronic kidney disease, CKD, but in rare cases it can lead to acute kidney problems. The risk increases if you're also taking NSAIDs or have existing kidney issues. Tip: if you notice swelling in your feet or ankles, a decrease in urination, or stop urinating altogether, contact your healthcare provider immediately. Common questions about Telmisartan. Does Telmisartan cause a cough? No, unlike ACE inhibitors, Telmisartan doesn't commonly cause a cough. If you experience a persistent cough on another medication, your doctor may switch you to Telmisartan or another ARB. Does Telmisartan cause hair loss? Hair loss isn't a known side effect of Telmisartan. If you notice thinning hair, it may be due to another cause, and your healthcare provider can help determine the cause and possible solutions. Will Telmisartan make me pee more? Telmisartan itself doesn't make you urinate more. However, if you're taking it with a diuretic, a water pill, like hydrochlorothiazide, you may urinate more frequently. If you're taking Micardis HCT, a combination pill that includes Telmisartan and hydrochlorothiazide, expect more frequent urination. By understanding these side effects and how to manage them, you can better navigate your treatment plan with Telmisartan and maintain your health. Always stay in touch with your healthcare team for personalized advice. Remember, good blood pressure control should make you feel better, not worse. Join our health community. Like if this helped you. Subscribe for more medication truth videos. Comment your Telmisartan experience. At HeInfo, we turn complex medicine into simple, life-saving knowledge.